You're watching KLTX, Channel 15, serving the city of Lufkin.
Dr. Robert Mauro serves as the market president of Houston and Southeast Texas at Blue Cross and Blue Shield of Texas. He leads the company's statewide efforts on media and public relations, executive communications, and influences strategy and coordination with sales and account management, network, policy development, government and community relations. He most recently served as the region's chief medical officer as well. Prior to his time at Blue Cross Blue Shield, Dr. Mauro served as the Director of Medical Quality for the Rural and Community Health Institute of the Texas A&M Health Science Center. And his previous experience also includes serving as the Chief Medical Officer for Memorial Hermann Southwest Hospital in Houston and practicing privately in family practice. He's a graduate of the Memorial Hermann Southwest Family Practice Training Program in Houston and the UT Medical School in Houston. And we've been comparing notes about medical school and residency training in Houston. He's an A&M undergrad, so those of you who want to whoop for that, you can. And received his MBA from the University of Tennessee. In addition to his work with Blue Cross Blue Shield, he serves on the Greater Houston Partnerships Board of Directors, the Board of Directors for the Houston Division of the Southwest Affiliate of the American Heart Association, University of Texas School of Public Health Fleming Center Board, and the Board of Affiliates for the Professional Science and Engineering Master's Program at Rice University. His CV goes on and on and on. His wife, Beth, and he have 2 children and 3 grandchildren. One of his kids is doing her rotations in medical school right now. He is going to talk with us about small towns, big solutions, addressing the future of healthcare for rural Texans. Please help me welcome Dr. Bob Mauro.
There we go. Well, good evening, and thank you for that. I'm a little tinny as well. Thank you for the kind introduction. I think my mom probably wrote that. And also, a big shout out to the Aggies in the audience. I'm never disappointed that when A&M comes, thank you. I always get a whoop. That's very good. And also for the applause when I came up, I appreciate that. I'm never sure I'm going to get that at the end. So getting it at the beginning is, kind of helpful. So thank you. As I get started, I've got 2 important things I want to make sure I share with you. And by the way, if you haven't figured out, I tend to walk around when I talk. My years as CMO showed me that I make a harder target that way if I walk. But 2 things I need to be sure and share with you before I really get started. Excuse me. The first is thank you. Thank you for inviting me here tonight. Everybody has been very gracious. I've really enjoyed getting to meet some folks. As Dr. Robert said, we've already had a chance to share some more stories from medical school, so I appreciate you being here. Thank you for that. And the second thing is, if you can't tell, my voice is kind of recovering. I've been dealing with some congestion and stuff, so my father would phrase me as having the voice of Frogman Henry. I never knew Frogman Henry or heard him, so I'm just going to have to trust my father that that's the case, so I apologize for my voice. Dr. Roberts gave you my background. It does help inform sort of the context of my remarks. Just private practice in Sugar Land, which is a town I grew up in for a number of years, and then chief medical officer for a large hospital in Houston. And then I worked for the Texas A&M Rural and Community Health Institute for quite a while, and we predominantly supported rural hospitals all over the state of Texas, and I actually tremendously enjoyed that time. And then I've been with Blue Cross now for about 6 years, and it's been going from the provider side to the payer side for me has been quite an educational and interesting experience. So I'm going to talk to you about something tonight that a lot of people are talking about, and that's what's going on in rural healthcare. I'll say a lot to my team and to the folks I work with, and when I get a chance to speak, that when it comes to healthcare and opportunities for improvement, in healthcare we are living in a target-rich environment, meaning we've got a lot of work to do to improve the way healthcare is paid for and delivered in this country. And that's only more difficult in rural areas. So there's a lot of discussion, a lot of things going on, talking about how we can improve access to care in rural parts, not only of the state, but of the country. But as I'll share with you, Texas is kind of a poster child for what's going on in rural areas across the country. So as a family doc, I dealt with patients, so it was a one-on-one. In my current role, I deal more with populations, with large groups of people. It's a very different thing, but it all really does come down to the patient. So I thought by just telling you a little bit of a story. Anybody know where King County is? King County is about halfway between Wichita Falls and Lubbock. As you can see, it's got a population of 282, makes it the second smallest county in the country, in the state, or the third smallest in the country. It's got predominantly one little town in it, and there's no clinic, there's not even a physician, there's just EMT services available. And Danny B. Tiffin, one day, he's an electrician, or was an electrician, 62 years old, worked for the 4-6s Ranch, and he started experiencing chest pain. And they were able to get EMT services to him, and then he started a 60-mile drive to the nearest place he could get help, and he didn't make it. And that's not an uncommon story. That happens all over the state. As a matter of fact, I was in El Paso meeting with folks from Texas Tech University Medical School in El Paso just these last couple of days, and one of the professors there had his wife broke her leg, and while they were out hunting in a rural part of the state, and he, as a physician, had to drive 120 miles to get her leg set. And for 80 miles of that, they were in white space, which meant he didn't have any cell phone coverage, any internet, anything like that. So these issues are very real, and they impact a lot of people in this country. So beyond the obvious, what's going on personally, and the fact that any of us might be driving through King County at any given time and need health care, why else is what's going on in rural areas important? Well, it's where we get what we eat, what we wear, and the energy to basically power everything we do. And so the rural areas are tremendously important in this country. Not only that, they're tremendously important to our economy. If Texas were a country, we would have the 10th largest economy in the world. And a lot of that economy is driven by what goes on in rural areas. So what goes on in rural areas is very important. And in Texas, we're very blessed in that we have these robust systems and this robust economy. We also have some significant issues. As actually I think Dr. Roberts said when he started out, we're dealing with a lot of issues around poverty, education, and infrastructure. We're not doing so great, and this is as a state. And everything I put up here is statewide, but it's magnified in rural areas. It's worse in rural areas. So as you can see, we're near the bottom on poverty, education, and infrastructure. And infrastructure is getting more and more important. With what's going on, particularly in the Permian Basin, the roads have gotten so bad there, and there's so many people moving in there because of what's going on with oil production, that there are significant miles of roads that are absolutely not safe. So a lot of things going on in the state, and particularly in our rural areas. So I'm talking about healthcare, so why do I bring up things like education, poverty, stuff like that? Well, as a physician, it's pretty humbling to understand that only about 20% of what we do in clinical medicine, or let me rephrase that, in terms of the ability to impact a person's overall health, only about 20% of that is really directly impacted by what we do in clinical medicine, by what physicians and hospitals and others in healthcare do. The other 80% has to do with social determinants of health. Really, what's transportation like? What's housing like? What are your food costs like? What's your education and income level? Those are really the 80% drivers of a person's overall health. And in in the rural areas, these become even more critical. So the saying now is that your zip code may matter more for your health than your genetic code, which a number of years ago I would have told you was a bunch of hooey. That's a medical term. So, but these things are important. And so in rural healthcare, lots of interesting challenges. We've had 168 hospitals in Texas close since 1960. That's the most in the country. So we're sort of the bellwether for what's going on in rural healthcare in the country. Unfortunately, in Texas, we lead the nation in uninsured, and rural areas lead Texas in uninsured. And there's really good data to support that having insurance improves your health. We did not expand Medicaid, just a decision we make in Texas. I'm not saying anything for or against it, it just is what it is. Not expanding Medicaid in a state that already has a high number of uninsured is just an issue we have to deal with. This is interesting. 147 counties in Texas don't have an obstetrician. Now there's 254 counties in Texas. That's like saying Nebraska does not have an obstetrician. Similarly, 185 do not have a psychiatrist, which would be like saying, Kansas, you don't need a psychiatrist. And so significant. And then 35 counties have no physician at all. And I'll break that down just a little bit more here in a couple of slides. Not expanding Medicare, this is just by the numbers what it has done. It's just had an impact, and it just means these are just issues that we as a state have to find a way to come to an understanding of and to deal with. So physicians, we graduate in Texas about 1,200 to 1,300 physicians a year. That makes us 47th in the country in terms of graduates. We're, depending on your census, we're the second or third most populated state. So we're very underbedded in terms of medical students, which is why we rank last in physicians per capita. 3% of physicians actually remain and serve in rural areas, despite the fact that our population, depending on how you count it, about 9 or 10% live in rural areas, but we only give them about 3% of our physicians in a state, again, that we already have too few. Most physicians practice in, have y'all been hearing the term DASH? Yeah, it was new to me. So most physicians are living in what we call the DASH markets. So that's Dallas, Fort Worth, Austin, San Antonio, and Houston. And that's where they go. And it's terrifically difficult sometimes to get resident physicians to go and then to stay there. And this is Dr. Ed Garner as an example. So Dr. Garner works in Culberson Hospital. Culberson Hospital is in the city of Van Horn, which is about 120 miles east of El Paso. And he's been the only physician there for years. He's in his late 60s. They're a bit nervous in Van Horn that they're going to lose their doctor. They did actually get a resident who had just graduated to come in September, and they're trying to be very nice to the resident because they want him to stay. But I did, and one of the discussions I had in El Paso just over the last couple of days is they're very concerned about making sure that Culberson Hospital retains a physician. It's a safety net area. It's out, literally 120 miles from the next medical center, and it's off of I-10. Any one of us could be driving along there at some point and need health care. And as he said, out here it's just me. So what do we need to do to try to more positively impact? Okay, so I turned my phone off. Sorry, but my watch just went off, so I apologize for that. You think you turn everything off. If my phone had gone off, it'd have been the Aggie War Hymn, so y'all would have gotten that. So anyway, lots of things that we need to pay attention to, and I'm going to talk about just a few tonight. Certainly, I already talked about physician workforce and transportation. I already talked about, I'm clicker challenged. I already talked about things like education, outreach, community engagement. I won't go too much into improving healthcare services per se, but I do want to talk a little bit about innovation and partnerships, because this is a multifactorial problem, what's going on in rural areas. It's a problem of a long time in the making. It's going to take everybody working together to solve it. And so it's going to take collaborative solutions. This is Dr. Dan Mccoy. He's actually my boss. The physicians in the room know you don't like referring to anybody as your boss, but it is what it is. And Dan is a really interesting guy. He's actually a dermatologist, and he's from Airedale, Texas. Population 332 as of the last census. And really a remarkable guy. And he really understands what's going on in rural areas. And he's right. He says, what we need to do in rural health care, we can't just keep patching it together. It's going to take a real moonshot type effort, which is a collaborative effort. And so that's why just not quite a year ago, we embarked on this effort with the Texas A&M Health Science Center and the Rural and Community Health Institute around a collaboration and working with them to find innovative solutions to address what's going on in healthcare in rural areas. I won't point out everybody up here to you, but this person, that's Dr. Nancy Deke. Anybody know of or know Dr. Deke? Few folks. Dr. Deke is a family physician. She's my mentor. I met Nancy as a medical student when she was in private practice in Richmond, Texas, solo practice. Nancy went on to become the first female president of the AMA and to also become the president of the Texas A&M Health Science Center, which managed medical school, dental school, nursing school, pharmacy school, School of Public Health, and the institute that I worked for a number of years, the Rural and Community Health Institute. And Nancy really understands rural health care in a very personal and meaningful way. And one of the things you'll hear Nancy, and I'm going to actually let you hear Nancy, but not in what I'm about to show. One of the things Nancy will point out is we have the same model of healthcare in rural areas that we had 70 years ago. We pay for it and provide it the same way we did 70 years ago. Well, then, or even 50 years ago, that was fine, because really you could do most of the things in a rural hospital you can do in a more urban hospital. That's not true anymore. Healthcare has changed dramatically. And therefore, the kinds of technology and equipment and resources you need to provide health care today are horrifically difficult for rural hospitals to have. I'm going to show you a little clip with Dr. Deke. But before I do, when you talk to her, what she'll discuss are all these things that we have to do in order to get rural health care correct. And you can see them up there. Distance, as I mentioned already, right-sizing access. Does every county need its own hospital? And then how do you get communities involved?
We hope that one of the great strengths will be the ability to take really big data and ask ourselves what happens when a hospital closes and healthcare providers leave a town. People obviously go somewhere for the care, but do they end up going too late? Do they have worse outcomes? Is the cost greater because they didn't get care in a timely fashion?
This is really about, one, using big data to identify which communities might be at risk, why they might be at risk, and then develop new ideas that are able to go into those communities and say, you know, this is probably a better way to provide access to health care for the people that live here.
So one of the things I've been very gratified for me personally is to get a chance to work with Nancy again on this collaboration and looking at how to improve health care in rural areas. And you have to pay attention to everything. Again, as Dr. Roberts said, if you want to improve the health of the population, you've got to pay attention to things like how much smoking is going on. What is the obesity burden and its evil cousin, diabetes? What's going on with transportation and education? One of the early things that we're finding out, this is very preliminary, but kind of interesting. In hospitals in rural areas that have been distressed, they're financially distressed, those that have had in a meaningful way have worked with their community around improving the health of the community, around tackling obesity, around tackling smoking rates, around making sure there are ways to be active, making sure children have safe places to play. Hospitals that have done that in those communities have shown an improvement in their financial health, which is kind of interesting. Because quite frankly, the way we pay for health care predominantly still in this country, if people are really healthy and don't go to the hospital, you think the opposite would happen. But we're not really sure why this is happening, but we think it may in part be due to just the collaboration and the sense of community that people stay and now actually utilize the services of their hospital, because some of the early data we're showing is that in some communities, as many as 75% of people actually leave their area for health care. Even though they love their local hospital, they don't necessarily use it. So we hope that this might be what that's showing. So there are there's four early projects that we're working with Texas A&M on that I'm very excited about. The first is looking at what happens to a hospital or what happens to a population after a hospital and that population closes. Because this can be a very big deal for a community. Typically, the hospital is the second largest employer behind usually just the school system. And so looking at getting real data around what actually happens to a hospital or to a population after it closes. It'll be interesting to know, and that data helps inform us in discussions with other hospitals that we need to work with around what's the right way to give their population meaningful access to health care in a way that that the community can reasonably support. There's early data actually that shows that when a rural hospital closes, the mortality rate in the region can go up by as much as 6%. There's no similar finding when an urban hospital closes. So there may be some real issues here that will need to be addressed, and the data we're getting from this will help inform quite a bit. The other one is, once a hospital does close, how do you reestablish care for the region? They're actually looking at one particular area where a hospital closed 11 months ago, and so they're looking at all kinds of interesting things like how can we have a more robust 911 emergency response system? What can we do, maybe working with the FQHC to get urgent care meaningfully provided in the region even though they don't have a hospital? What is the place for telemedicine? In my opinion, we way underutilize telemedicine, not only in the urban areas, but certainly in the rural areas. But remember that white space thing I said earlier about the physician in El Paso driving, and for 80 miles, he had no access? You can't do telemedicine where you don't have internet access. So those are all issues that will have to be explored. But they're doing some really fun and interesting work around reestablishing access after a hospital closes. This one may be one of the most interesting. So this is looking at maybe every county doesn't need its own hospital. Every county usually thinks they do, but maybe every county doesn't. And maybe if we can get a number of different counties to come together and collaborate with each other, we can identify how to make sure that their community still has access to healthcare in a way that the community can support. Now, what's interesting about this is a 6-county area. Now, I mentioned we had 138 hospitals have closed since 1960. We have about 162 what would be classified as rural hospitals in Texas. If you've seen one of those 162 rural hospitals, you've seen one rural hospital. They're all different, and each community has its own culture. So these are 6 counties we're trying to get them to come together and share how they can provide access to health care. And sometimes you couldn't get the 2 counties to agree on lunch. And so this is going to be a really interesting and I think thought-provoking study, which should give us a lot of data and ability to hopefully migrate to other parts of the state. And the last one is critically important. As I mentioned, everything is sort of maybe bigger or worse in rural areas. So rural areas tend to have a population that is older, sicker, and less insured. So reasonably managing chronic disease is critically important in rural areas. It's also very difficult. But it needs to be done because I'm a family doc, and I used to always tell patients that, the most clinically and financially effective way to manage an illness is in fact not to get one. Or if you have one, to identify it early and treat it effectively so you don't need the rural hospital or you don't need to access it so much, so that when those 6 counties come together and decide how to provide access, you're not overutilizing resources that might be needed for other areas. So this is really looking at how to better manage chronic disease in rural areas. Really cool stuff going on here. It's kind of my favorite one. They're looking at things like autonomous vehicles. What is the role for autonomous vehicles? Because transportation is a huge issue, particularly for an elderly population in some of these places. They're even looking at things like drones. So this has been an education for me. I don't know, I learned this. I hope it's true. I'd hate for the truth to get in the way of a good story. But apparently ranchers now can have drones that actually go out over the herd and can identify a specific cow. Is that right? I think I'm right. Because I have a chip, a GPS, like identify the cow, and the drone can swoop down on that cow and get a blood sample, and so that they can. You're getting it, yeah. Grandpa's out on the porch. He needs his blood sugar checked. I mean, you got to do what you got to do. But anyway, very exciting things that they're doing with in terms of technology. They're looking at ways to actually do telemedicine, where they actually set up like remote booths where you can have an urgent care visit in the police station or some place in a community that has something that's open 24/7, who can make sure there's reasonable access. So literally it's like a doc in the box, but the doc actually isn't in the box. They're somewhere else talking to the person in the box. But they're really looking at what I think are some pretty cool technology solutions to provide access. So I'm really excited about this, because we really do need to make sure that when people like Danny B. Tiffin and even the professor at Texas Tech El Paso need health care in some of these areas, that health care is there for them. And so I'm really excited about what we're going to learn. And As I said, Texas is kind of the bellwether for rural care for the nation, and we think what we learn here in Texas and the implementations that we establish here in Texas will actually have meaning across the country. So I'm just going to finish here real quick and tell you what I maybe should have done when I started, just about Blue Cross, so you'll have some context. We're celebrating our 90th year, which means healthcare as we know it started 90 years ago. Health insurance as we know it started 90 years ago because actually health insurance as we know it started with Blue Cross and Blue Shield just up the road in Dallas. As this is, those of you who might be on a game show, you'll know this. It actually started as a way for school teachers in the Dallas Independent School District to afford the cost associated with childbirth. I should probably not tell you part of the rest of the story, which is for the premium of 50 cents a month, they got 21 days of hospitalization at Baylor Hospital in Dallas. But that was 90 years ago today, and that's how we were member-owned then. We're still member-owned. We're the only insurance company in all 254 counties in Texas, which also is in part why what is going on in rural Texas is so important to us. And with that, I just want to thank you. I appreciate everybody being here. I appreciate how gracious you've been, and I think you're going to have an exciting evening going forward. So thank you very much.
You know, this points out how important the entire business community, banking, education, government is to healthcare provision in our communities. I imagine Trent Ashby was listening intently when they were talking about rural hospitals closing, because I know how important the Crockett community situation has been to him and others as well. DebtCog with broadband access, how important that is as well. So healthcare is not just what happens in the hospitals and the doctor's offices. Just about everything we do in the community impacts our overall healthcare. So thank you, Dr. Mauro, again for speaking. And we now get to move on to our awards tonight. So our first award to be presented this evening is the Nurse of the Year Award. Now, our Nurse of the Year has been described as passionate, confident, empathetic, dedicated, people-oriented, and a great friend, mother, grandmother, and church member. To say she is a seasoned nurse is an understatement, as she has been working in the nursing field for more than 30 years. And like many nurses, she worked in many different areas, including OB, med-surg, garnering numerous grateful comments from patients about her care. Leadership was a natural fit for her talents and skills, and she now serves as house supervisor, an important managerial position with patient care, staffing, and administrative responsibilities, which she handles very well. Her compassion for others led her to become involved in the SANE program as a sexual assault nurse examiner. Her church activities and leadership have garnered praise from her pastor, who calls her a modern-day Renaissance woman. A co-worker and friend once said of her, "If I ever had to ride out a hurricane or spend time on a desert island, I would hope that she would be spending those hours with me, because she has enough stories from her years as a nurse that if she started telling them, the hours would fly by." She lives life to the fullest and helps everyone around her enjoy it just a little bit more, because she can make you smile. Let's watch our video about our Nurse of the Year.
I think Janie was raised to be a nurse. Her mother was a wonderful woman. She had a servant's heart. And I think Janie always wanted to serve, whether it was serving in her church, serving in her community, or serving others at the bedside. I think that's the way she was raised.
I worked with her before where she would work a 12-hour night shift, get off from there, drive 30 minutes to an hour to go help some elderly people that she was real close with. So it's just, she's an asset to everybody around.
Well, some words that I would use to describe Janie, she's extremely passionate about what she does. She's a nurse advocate at all times. She's very energetic. You never see her sitting, you never see her stopping. She's just going from place to place as fast as she can. And I mean, she's very loyal to our institution. She's been a long time member of our team and really goes out there and promotes everything that we do at the hospital.
She never meets a stranger, and if she does, by the time the conversation's done, she either is kin to you or knows somebody who is kin to you. My own parents think that she's their child too. So she has just, like I said, made very personal contributions to the healthcare. You know, she's not on a lot of committees, she's not on a lot of board of directors, but she's down on the personal level.
I nominated Janie because she embodies all of the aspects that I believe a nurse should have. She has strong faith, and if you have faith and you believe, I think you can move mountains. And she has demonstrated that not only in her work life, in her church life, but in her home life, in caring for her 4 children and her husband, and then going through some personal challenges with taking care of her mother and then losing a child. She's a great mother, great grandmother, great wife. She's a great friend.
She truly is one of those special nurses. I mean, she's out there, she's so compassionate. I've seen her interact with customers, I've seen her interact with staff, I've seen her interact with patients, and at all times she's always on exactly, to whatever that person is. And she just exudes confidence in the situation regardless of how difficult it is. And she exudes that empathy for that person. And so no matter how upset somebody is, she can diffuse it and she can help move them to a better spot. And she's just really what you would want in a great employee. I mean, I wish we had hundreds of Janie Lees at our facility. I mean, we're very lucky to have one, and we feel very fortunate every day that Janie's working. I know the hospital's in good hands when she's there, and I know that she's going to continue to do her best to make sure that our organization remains successful.
We went on a 10-day road trip in an RV this summer, and neither one of us had ever been on an RV road trip. We chose Yellowstone National Park to go to, and it was funny because, like I said, we'd never been on anything like that, and Janie said we were 10,000 feet above Jesus once we got there because it was full of mountains and all. We vowed never to go that high again when we go on another one, but we ran the trip like we ran the hospital. We were very methodical. We, had our plans, we had our backup plans, and the same way that you would run a shift at the hospital. So, that made it easier. And plus, I've known her so long that we got along great, and it was good.
More than anything, I just want to say thank you. I mean, in our roles as leaders in hospitals, and she's out there doing a lot of things that go very much unnoticed, and we can never tell her enough thank you, because at the end of the day, we appreciate all that she does, and she's truly making a difference every single day.
She has mastered the art of caring, and I think she deserves this award.
Love you, sister.
Ladies and gentlemen, help me congratulate our 2019 Nurse of the Year, Janie Lee. Janie, do you know all of your children are here? Yes, they're in the back. Come on up. Come on up.
my gosh. Oh my gosh, thank y'all so much. This is pitiful. I love it. Oh my goodness. I guess that's why Curtis would let me wear those flip-flop shoes, and now I'm at y'all. Where's Sarah? Oh my gosh. Thank y'all so much. Thank you so much. Kathy, Deborah, Drew, everybody. Thank y'all. Curtis. All those kids who are there, thank y'all. Thank you so much. I love nursing, I love people, and thank you again.
Our healthcare professional of the year this year is a Texas native, but his or her undergraduate training was Indiana, followed by medical school in Illinois, and finally internship, residency, and fellowship training in Michigan. This person worked in Florida and North Dakota before circling back around to Texas. And back in Texas, this physician and spouse love spending time on their farm with their cattle. They have 2 children who are also in medical fields. And though Texas-born, this physician is fairly new to Lufkin, having moved here in 2014 to start a brand new program caring for some of our most vulnerable, dare I say, tiniest patients. Our physician is described as compassionate and energetic despite being on call 24/7, 365 days a year as the first and only full-time neonatologist in Lufkin. Let's watch our video about our healthcare professional of the year.
When she first heard that Lufkin, Texas was opening the first neonatal unit in the deep East Texas area, she did a little bit of research and realized that we were sending all of our critically ill patients to Houston and sometimes as far as Shreveport. She realized the benefits of opening a local unit. It would only not bring stability to parents and families. It would improve the outcome of the tiny population that we have. With her accepting this position and coming on as our only town's full-time neonatologist, she has brought a much-needed service to our community that we never had before.
With Dr. Chase, Rowan was born a month premature, and we were in NICU for 9 days. And Dr. Chase just calmed our fears and helped us get through what he had to do to get home.
She's very compassionate. I mean, that's probably the best word. I mean, she treats those babies like they're her own baby. She's very energetic, and she has a true, faith in trying to do the right thing by all of her patients. In this day and age, physicians, particularly one who's on call 24/7, 365 for her patients, because she's the only neonatologist we have. And so for her to be able to do that and still have that level of passion about everything she does, we're very lucky.
Dr. Chase was really fantastic. She would come in and check on our babies, and my husband and I still talk about it to this day. She would call her a little toots, and she'd tell us, "You have a nice little toots," and so we still refer to her as that. And she was just really great, and she would give us updates and let us know everything was going to be okay.
She was so helpful. Days that I couldn't be there in the morning, she would call me first thing when she got there, told me everything that was going on. If he didn't eat well, she made sure to change his plan. She was great.
When you get to know her, you learn that for years she has taken a weekend of her life every month, flown back up north where she used to live, because the hospital up there still needed a doctor with her credentials. And so she would give her time here in Lufkin all week long. She'd fly home on the weekend. But that would just amaze me. And I would ask her, Linda, why do you do that? And she'd say, well, they don't. They haven't been able to find a replacement doctor. So, you think about her. She's very skilled. She's very talented. She's very much needed, not only here, but there. But yet when you talk to her, very normal person, down to earth.
She really is the NICU at Woodland Heights. I mean, when you think of our program, you think of all those babies and mothers and fathers and lives that have been touched throughout the years of our program. I mean, it's really a tribute to all of her hard work and dedication. And every day she's pushing us to be better and pushing our program to new heights to make sure that we're providing that best level of care. And it's really a tribute to her and her leadership within our institution.
I think she deserves this award because she has gone above and beyond the duties of her only town's full-time neonatologist. She works hand by hand with the local pediatricians, the OBGYNs, and other physicians to ensure that our tiny population deserves the best care possible.
Linda, we're thankful to have you in Lufkin. We're thankful to have you at Keltis First Baptist Church. We appreciate what you do, and what a joy it is to know that you're getting honored for what you work so hard doing. Congratulations to you, Linda, on your work and on your achievements. We're all proud of you and thankful for you.
I just want to say thank you so much. No, you really took care of him, and he's getting nice and strong now.
You have been a team leader, a role model, and one of my really good friends at work. I'm honored to be underneath you and work with you day by day.
Can you say
thank you? Can you say thank you? You gotta say thank you. You gonna be bashful?
Thank you.
Thank you, Dr. Chase.
Dr. Linda Chase, our 2019 Healthcare Professional of the Year.
Thank you so much. I don't think Henry had any idea what he was in for. He and I got married a couple of weeks before we moved down here. And he wakes up in the morning to an empty house. I'm running down the hallway screaming about quadruplets. I mean, I would not be able to do what I do without his support. Thank you so much, hon. But I love the vision that Woodland Heights had. It just broke my heart to think that all of the babies in this area are being sent so far away. We just had our 6th reunion for the newborn ICU. We've had 800 children that got to stay local because Woodland Heights had the idea, put their money where their mouth is, and has insisted on the best of everything for our local kiddos. So it's been an honor working with you all, and we look forward to years ahead. Thank you so much.
So our Individual of Merit category is designed for those who may not necessarily be a part of the healthcare community, but whose contributions to healthcare in our community are especially noteworthy. This could be a board member, a philanthropist, journalist, government official, company or foundation, executive, community leader, volunteer. Our Individual of Merit this year is described in terms that one would expect to be used for a soldier or warrior. And that is what this person is. But her battle was not a military battle. And yet other descriptions note her humor, compassion, and selfless love. Perhaps that makes this person a benevolent pit bull, but you can be the judge of that here soon. Our Individual of Merit entered the healthcare arena as a patient trying to navigate a complex system involving multiple specialists, tests, referrals, authorizations, procedures, and treatments. She had barely turned 30 years old when she was diagnosed with breast cancer. Even in the depths of her treatment, she was always thinking beyond herself. What she has accomplished this last year will be a lasting and ongoing benefit to our community. Let's watch the video about our individual of merit.
She is bold. She is courageous. She is a fighter. She is unstoppable.
I would describe Ashley as a very loving, caring, compassionate, extremely funny individual. There was a time when I didn't think she was going to take anything seriously because she was so silly. But I'm very proud of the woman that she's become.
I've known Ashley right now about 7 years. We've both prayed for a godly friend, and that's one thing, I never really had before. And I say, God, I need a friend that's going to help me, push me to be a better Christian, a better person. And so we both, at the same time, unknowingly prayed, and it just kind of, it was kind of weird how things kind of worked out, so.
When she puts her mind to something, there's nothing that's going to stop her. When she was diagnosed with cancer years ago, and it wasn't good. It wasn't a great prognosis. It wasn't extremely detrimental, but it wasn't. She was very hopeful, and when she was cured, when she was healed, she knew that she wanted to use that experience to better other people, to help other people. And she has used the worst time of her life to do something extraordinary for the community of Lufkin and all of Angelina County.
She's probably, one of the most loving, forgiving people that I've ever met, and also selfless. She thinks about others before she even thinks about herself. I remember going to one of her chemo treatments at MD Anderson. I remember her several times praying over other people that were going through treatment with her. Like, she stopped, she was in the midst of going through cancer and chemo and everything, and or getting an ultrasound or whatever, and she would stop and pray with people. And not very many people would do that. They would be caught up in their own situation, but she thought less about herself and cared more about other people.
It's people that will engage their faith and their passion, that look beyond themselves and can help meet the needs of other people. That is worth recognition.
Of course, she has founded within the last year the East Texas Cancer Alliance of Hope. The alliance seeks to bring tangible hope to individuals in our area, in our immediate area, that are afflicted with cancer. Everything from paying utility bills to gas vouchers to any number of things. She is seeking and has accomplished the goal of providing those things to the community.
To have somebody with the compassion and the heart for those people to lead the way for the rest of us, to have an opportunity to give and to serve and to help people whose insurance won't help them and who just don't have the means and the resources to help them. It's huge what she's doing here.
Ashley's all in. Whether it's babysitting kids that are not hers, to fighting a major disease, to then helping other people, she is going to be creative. She's going to be bold. She's going to have fun doing it. She's going to challenge you along the way.
It means the world to me to have her as my daughter. I mean, she's a businesswoman. She is an entrepreneur. She's just done so many things that make me proud.
Ashley Berry, you are the bravest, most courageous woman I know. You make me want to be a better woman. You make me want to be a better mom. You make me want to be a better person in my community.
She is following in the footsteps of great advice from the book of Proverbs that she's speaking up. And Ashley, you have a beautiful voice. Not only are you beautiful on the outside, but your strength, your courage, your boldness, your way to dream, keep speaking up for other people. Very proud of you.
she believed in me at the many of the lower times in my life the last few years that I didn't believe myself. And if it wasn't for her pushing me, motivating me, not, you know, her seeing past the what was going on, then I know Tomei or myself wouldn't be where I am today.
You're an inspiration to not only me, but you're an inspiration to my family, to my boys, and to our entire community. Thank you so much for all that you do. We love you so very much.
Our individual of merit, East Texas Cancer Alliance of Hope founder, Ashley Berry.
I thought it was because they were trying to get an insurance check that they were all here tonight. My mom and my son and Brittany, and thank you. After today, when I had a client call to say that she's facing eviction, another to say that they feel like they're about to lose the land that their trailer sits on currently. Another who is caring for her husband with cancer, and they've depleted all of their savings, and they just needed their light bill paid. I'll continue this work until I can't work anymore. With the little that I have and this great community, I'm confident in the fact that we will pay light bills, we will pay rent, we will pay every utility. Kids will have exactly what they need. I promise you that. Thank you.
Make your checks out to East Texas Cancer Alliance of Hope. Now it's time for the Lifetime Achievement Award. This award is to be given to someone who has had an extraordinary impact in the Lufkin, Angelina County healthcare community over a lifetime. And I'm sure you will all agree our recipient fits the bill. In past years, this award has gone to physicians, nurses, and an administrator. Both women and men have been honored. Our honoree first arrived back in Lufkin, more than 50 years ago. You see, both our honoree and spouse are Lufkin High graduates. Our honoree even attended SFA, then received further training at a professional school in Houston. I can't tell you what at this point. The Army called, but then our honoree returned home to set up a new and unique practice to Lufkin. We talk about other awardees being caring, compassionate, and able to make you smile, but our Lifetime Achievement Award recipient really could make you smile. Our honoree is known for excellence in his field, and the evidence of his handiwork is to be seen literally all around you. Not only was this healthcare professional gifted in his field, which he practiced for many decades, he gave back to the community in so many ways, serving on the boards of Lufkin ISD and Pinecrest Retirement Community, his church, cooking for the Round Table. Even after retirement, he created a mentorship program for high school students after working on the Chamber's Vision 2020 Education Committee, encouraging students to discover their aptitudes and think about future plans, careers, and college. He also mentors at the Christian Men's Job Corps Field House. Let's watch our video about our Lifetime Achievement Award recipient.
I've known Charles and Beverly for about 50 years or better. Charles and Beverly came to my office about 1967 after Charles got out of his residency and wanted to know what I thought about him coming to Lufkin and starting a orthodontic practice. And of course I was all for it because we needed an orthodontist, and Beverly was with him, and I could tell we needed these people. What I didn't pick up was how much he would be an impact on the integrity of this community.
If there is such a thing as a community servant, he is a community servant. He has served on the school board. He has taken on in the Project 2020, he took on the education part of that and has continued ever since its inception. So he has continued being part of all the schools in Angelina County and just keeps in touch with the students.
I mean, Charles makes you a better person when you're around him. He actually makes you want to be a better person.
Charles is very tenacious. He's very complete. His orthodontics is unquestionable. He is just a complete orthodontist. When I say that, there's a lot of people walking around with beautiful smiles that Charles has done, and you can tell because they're just absolutely beautiful. And so he's been a really good asset to our dental community and to the church community.
For me, I was a kid with really big front teeth and then really tiny teeth that were all jagged and crooked. And so Dr. Kent put braces on me 4th through 6th grade, so I had them early. But he just allowed me, I think, to probably have a little bit more self-confidence in myself, because I was always made fun of with big teeth. I was called Bugs Bunny, and he just allowed me to, I guess, be more confident.
Dr. Kent became a part of our feed store roundtable group, and Dr. Kent started working in our ribeye sandwich booth. And Dr. Kent treated a ribeye sandwich the same way he would treat teeth. Everything had to be laid out perfectly. The meat had to be in a certain position and the onions had to be in a certain position. So whether he's straightening teeth or building a ribeye sandwich, it was going to be straight when it was done. So
I think Dr. Kent is authentic. He is such a godly man. And, he's just so fun-loving. I have so many great memories of seeing him as a patient. And then now it's fun to be able to call him my friend as a grown-up.
I basically think Charles tells you he's going to do something, and he does it to the utmost perfect way that he can do it. And it's usually very perfect. That's what I kind of call integrity. Everybody respects Charles.
He's also been a great Christian human being that cares for everyone in the community, and is just by far the neatest guy I've ever been around in my life.
I do get concerned in our culture about the baton being passed. You have the greatest generation, the World War II generation, and I wonder if those great people still exist. Well, they do exist in Charles Kent, and it makes me want to be that guy. And anybody who knows him, anybody who's honoring him tonight, knows that I'm not just saying that. He is the real deal.
He is just a great human being that cares about his community and wants to make this a better community, whether he's serving from a church standpoint or an orthodontist standpoint, or whether he is serving a ribeye sandwich. If there is such a thing as giving a lifetime, he has given a lifetime to this community.
Thank you, Dr. Kent, for giving me a great smile.
Ladies and gentlemen, Dr. Charles Kent, our Lifetime Achievement Award winner.
Do I get to say something?
Yes, sir.
Thank you. I'm very humbled by this. Would never have dreamed it. Thank you, those that chose me. But I have to tell you, this honor belongs to a really big team. Starts back with my parents. I'm not going to take long. I know 8 o'clock, is the new 80 is the new 60, and 8 o'clock's the new midnight, so it won't be long. So we go to my parents. As a young kid, they used to call me Bugs Bunny and Peter Rabbit, and I had teeth that went around the corner before my face got there, and they told me I could eat corn through a picket fence, and I think I probably could have. But my parents sacrificed and let me have braces in orthodontics, gave me that gift. And so I was so intrigued with that process, and I just love the change that it created. And so I decided at that time, I believe I was in the 7th grade when I got my braces off, that I wanted to be an orthodontist, and that dream never left. I appreciated what they had done. So then next on this team came Beverly, the love of my life. God gave me the gift of her, lover, friend, lifelong companion. Beverly worked her way through college, and then she worked our way through dental school. And thank you, Bev. And thank you, Lord, for Bev. I also thank our Lord for giving us 2 lovely daughters, 4 grandchildren, and a pretty dadgum good son-in-law, Amy. Well, following dental school were 2 years in the Army and then an orthodontic residency, and finally it was time for me to go to work. So I thank Bubba Shands for giving us a Get Started loan, which we very badly needed. I give thanks to an incredible and loving staff that cared for me and cared for our patients, loved everything they did and took good care of me. 2 of them are here tonight, Tina Turner and Darla Wynn. And I have to tell you about my first secretary and dental assistant and everything else that was involved. Her name was Pam Davis, and many of you know her, and she set a tone for our practice. But I want to tell you about her letter of application. It's different from today. She wrote me a letter, and she said, I'm the mother of 6 kids. I'm a great wife. I have a loving husband. I can type, and I will make you a great employee, and you won't be disappointed in me. That was the extent of vetting Pam Davis. Much different from today, and she proved all those things to be true. I'm also grateful to the family dentist that embraced us entrusted us with their patients without really knowing me. Their trust and confidence was crucial to our practice. Some of those I have to mention names were Sonny Clement, Andy Jordan, Woody Ingram, Marion Crowley, Bob Rhodes, all very qualified dentists of great integrity. They and their wives, and then friends like John and Ann Woods, the Chandlers, the Cowards, Tom and Donna Willis embraced us to others, and we remain very thankful to that. And next came patients and parents. They, and many of you here tonight, trusted us with your care and your kids' care, which meant a lot. And we thank you for that very much. Thank you.
Anybody who had kids in Charles's chair, I looked at his shoes. Unfortunately, he has tassels on and not laces, or I would have stood there and tried to tie them in knots while he was talking. Does that ring a bell with anybody? We have many previous award recipients with us tonight as I look around the room. If you're a previous Salute to Healthcare Award recipient, would you just stand for a second so we can recognize you? So again, congratulations to our recipients tonight, and thank you again to Dr. Mauro for our talk. Physicians, remember to fill out your evaluations and drop them off at the table outside. And on behalf of the Lufkin Angelina County Chamber of Commerce and the Salute to Healthcare Committee, thank you again for your support and coming tonight. Be safe driving home. Good night.